Anterior dislocation of shoulder. In anterior dislocation of shoulder, clinical presentation is the arm will be abducted and externally rotated into the shaking hands position. Shoulder dislocation is the most common type of joint dislocation because the head of the humerus is substantially larger than the glenoid fossa. It is more common in males than females. It occurs in young patients 20 to 29 years of age. Anterior shoulder dislocation, displacement of the humeral head anterior and often also inferior to the glenohumeral fossa. Clinical features: in addition to pain and restricted range of motion, arm is typically held in abduction and slight external rotation, humeral head palpable below the coracoid process, loss of shoulder contour, prominent acromion, and flattening of the deltoid muscle. Do assess neurovascular status. There may be deltoid paresthesia due to the injury of axillary nerve. Anterior dislocation of shoulder. Patient is leaning towards the injured side. Patient is holding the arm away from the body. The arm is slightly externally rotated. There is a loss of the rounded shape of the normal shoulder, more obvious in thin patients. The acromion is prominent. There are two angles being formed here. This line is not in alignment as on the normal side. This is the arm. It is abducted and slightly externally rotated. This is forearm. It is internally rotated and pronated. Anterior dislocation of shoulder, prominent acromion, arm is slightly externally rotated and abducted, forearm is internally rotated, elbow is flexed. Deltoid paresthesia. Cutaneous distribution of axillary nerve is over deltoid muscle. Axillary nerve injury can cause deltoid paresthesia. This is normal lateral X-ray Y view. This is coracoid process. This is clavicle. This is acromion. This is humeral head, scapular body. The two limbs of the Y are formed by coracoid process and acromion. Stem is formed by scapular body. This is normal lateral X-ray of shoulder. Here is anterior dislocation. Humerus has dislocated anteriorly, medially and slight inferiorly. This is normal. Humerus is located in the glenoid fossa. Anterior dislocation. Humerus is dislocated anteriorly and there is empty space in the glenoid fossa. Treatment. Treatment of anterior dislocation of shoulder is closed reduction of glenohumeral joint with sling immobilization for 3 weeks, else pain management. Broad arm sling using triangular bandage. Thank you.